My name is Renae Stiers. I'm a UW-Stout grad student, and I'm also a registered dietitian nutritionist. My research day project is on the association between frailty and delayed graft function in kidney transplant recipients. So this presentation will go through an introduction, methods, results, conclusion, discussion, and the references. So we'll start with the introduction. So for those who have diseases related to chronic kidney failure, dialysis is often the first life-sustaining treatment. However, receiving a kidney transplant for these individuals can allow them to not depend on regular dialysis treatment, which in turn lowers their overall risk and increases their quality of life. Receiving a solid organ transplant does not come without risk, however, and a common complication that can occur is called delayed graft function. So delayed graft function, or DGF, is when the donated organ does not immediately graft or start working as it should once it's transplanted into the recipient's body. Experiencing DGF following transplant tends to lead to other negative health outcomes later in the recipient's life, such as acute rejection or even total organ rejection. So there has been previous research that has found that having increased muscle strength or being not frail can improve one's overall long-term health outcomes. So this research aimed to study what the association is between frailty and delayed graft function. Or in other words, does one's frailty have an impact on their DGF risk? The hypothesis for this research is that yes, frailty does have an association with increased DGF risk. So moving on to the methodology of this research, the sample size included individuals who were admitted to the UW University Hospital located in Madison, Wisconsin between January 24th and February 24th of this year. To be included, the participants had to be admitted for a kidney alone transplant, so they could not be admitted for a kidney pancreas transplant or a kidney liver transplant, which is sometimes the case. So DGF was defined as participants requiring at least one dialysis treatment within the first 2 weeks following the transplant operation. It should be noted that the severity of DGF was not recorded in this research, though it can vary from person to person. DGF occurrence was recorded as either positive, as in it did happen, or negative, as in it did not happen. An individual's frailty score was assessed using the pre-transplant evaluation done at the UW Health Transplant Clinic. Frailty scores were assessed using the Freed's Frailty Scale, which is a score out of 5. Frailty scores between 0 and 2 indicated non-frailty, where a score of 3 or greater indicated frailty. Participants were recorded as either being frail or not frail in this data. All the data and software analysis was done using Jamovi programming software, and an independent t-test was used for statistical testing with a statistical significance set at a p-value of less than 0.05. All right, moving on to the results. So over the total month of data collection, 27 participants were included in this study. DGF occurred in 18.5% of those 27 participants, and the most common frailty score was found to be 0, which was about 48.1% of the population, closely followed by the second most common frailty score of 1, which was 44.4%, and the least common frailty score was 2, which was 7.4%. So it should be noted that no individuals in this population had a frailty score of 3 or greater, indicating that no participants were found to be frail. Total frailty scores, DGF occurrence, and the number of participants are displayed in the figure on the poster or on the screen right here, though I'm kind of covering up one of the scores. But as you can see, no scores of 2 or above were indicated, and there were no DGF occurrence in those with a score of 2. Since there were no frail participants, a proper independent t-test was not able to be completed, as the variable of frail patients was essentially missing. So moving on to the discussion of this research, since there were no participants found to be frail, there can be no distinct conclusions made regarding the association between frailty and DGF occurrence from this study alone. Though there was some variance in DGF occurrence between those non-frailty scores, so scores of 0 to 2, It did not appear that having a lower frailty score such as 0 or 1 had any less risk of DGF compared to having a frailty score of 2, though all those numbers were considered non-frail. There was no statistical analysis test done on the individual frailty scores. That should be noted. So there's no substantial evidence that has concluded that there is an association from this data set alone. However, there has been previous substantial evidence done by researchers that have studied frailty and DGF occurrence. And from these past studies, there has been a suggestion that there's indeed a very strong association between frailty and DGF risk in transplant patients. These studies have found that other health risks are also associated with higher frailty, such as mortality rate as well. So moving on to the conclusions, unfortunately, there is no definitive conclusion that can be drawn due to this data being incomplete. Thus, the implications from this research are limited, and the answer to the research question or hypothesis cannot be determined from this data set alone. However, from the previously mentioned research related to the studies do suggest a strong association between frailty and DGF risk. There should be additional research regarding this topic, and it would be beneficial to add to the discussion of the association between the two variables. Ideally, the research would involve a larger sample size and adjust for confounding variables such as age between the recipient and the donor, type of donation such as the type of organ that's being donated, source of organ donation as in living or deceased donor, and many other confounding factors that might increase DGF risk. By improving our understanding of the risk factors for DGF, we can essentially decrease its risk and occurrence and thus decrease other negative health outcomes that can be associated with DGF post-transplant. Here are my references for you. The previously mentioned studies that were great in studying DGF and frailty are included here, so be sure to check those out if you're interested. And that's all. Thank you for listening.